So hello everyone, our today's topic is on a temporal region. So we are going to discuss is the temporal and the infratemporal region. First of all is the temporal region. So the temporal region, it is located on the side of skull, and it is remember, it is demarcated by a superior temporal line. So this region represents the superior temporal line and the zygomatic arch. So this region represents the temporal region. So picture it as a key area where essential movements like the speech and the mastication comes to life through the temporomandibular joint. That is the sole joint connecting the skull base to the mandible. Now let us discuss the boundaries. What are the boundaries of this temporal fossa? Anteriorly, it is formed by the zygomatic and the frontal bone. So this bone is the frontal bone and this one is the zygomatic bone. That is the anterior boundary. The posteriorly, it is formed by the inferior temporal line and the supramastoid crest. So this one is the posterior boundary. The superior, there is superior temporal line. So this superior temporal line, and inferiorly it is composed of the zygomatic arch. Now remember the floor, it is composed of very important structure, that is it is composed of parts of frontal bone, frontal, parietal, squamous, temporal, and the greater wing of the sphenoid bone. So that region is called pterion. So remember that for your exam point of view. So pterion, it's like in the anterior part of floor where frontal, parietal, squamous, temporal and greater wing of sphenoid, they meet at H-shaped suture. Important is the temporalis muscle. It attaches to floor and inferior temporal line. Now what are the contents of the temporal fossa? So number one, the first content is the temporalis fascia. Other is the temporalis muscle. Remember the muscle, it is important for chewing. It finds its attachment on the floor and inferior temporal line. Other is the middle temporal artery. The middle temporal artery, it is a branch of superficial temporal artery. So that is responsible for the blood supply in this region. That arises from which artery? It's the maxillary artery. And remember, keep in mind that the middle meningeal artery, it is a significant branch, is vital as its injury. Middle meningeal branch injury can lead to extradural hemorrhage. Other regions are zygomatic temporal nerve, deep temporal artery. Next is the infratemporal fossa. So what is that? The infratemporal fossa, it is an irregular space that is located, the infratemporal space, it is located beneath the zygomatic arch within the skull. So it has a specific boundaries. Anteriorly, remember there is posterior surface of body of maxilla and medial surface of zygomatic bone. The roof, it is covered by greater wing of the sphenoid bone. The medially there is lateral pterygoid plate and laterally there is a ramus of mandible. Now what are the contents? Lateral pterygoid muscle, mandibular nerve, maxillary nerve, coda tympani nerve, second part of maxillary artery, posterior superior alveolar artery. Now what are the landmarks on the lateral side of the head? The first structure that you can see is the pinna. Second, zygomatic bone that forms the prominence of the cheek region at the inferior corner of the orbit. Other structure you can see is the mastoid process pterion is an important structure that is found in the temporal fossa where the four bones meet, that is frontal, parietal, temporal and greater wing of sphenoid, that is marked by H-shaped suture, and it is important landmark as it overlies the middle meningeal artery and it is susceptible to injury. So these all are landmarks for clinicians, surgeons to accurately locate the structures, perform procedure and understand the external anatomy of head and neck. Now let us move to what are the muscle of mastication. The muscle of mastication, remember they are the masseter, temporalis, lateral and medial pterygoid, and they develop from the first branchial arch and they are supplied by the mandibular nerve. So masseter, it is a powerful jaw closing muscle located on the side of face. The temporalis, it is positioned on the side of head. The temporalis muscle originates from the temporal fossa. The lateral pterygoid, it is involved in jaw opening. It originates from the greater wing of sphenoid and inserts into the mandibular condyle. The medial pterygoid muscle, it is involved in jaw closing and it originates from the medial surface of lateral pterygoid plate and insert into the mandible. So these muscles, remember, they develop from the mesoderm of the first branchial arc. The muscle of mastication, they are primarily innervated by the mandibular nerve. That is a branch of, remember it's a branch of trigeminal nerve. So remember the trigeminal nerve, it serves as nerve of the first branchial arc. Now let us discuss the various muscle. The first is the temporalis muscle. Remember the temporalis muscle, it is a fan shaped muscle. So this muscle is the temporalis that fills the temporalis fossa. So it originates from the temporal fossa excluding the zygomatic bone. It originates from the original entry point is the entire rim of the temporal fossa of the skull. Where does it insert? It insert into the deep process of the coronoid process of the mandible, right? So the anterior fibers, they run vertically, the medial fibers run obliquely, and the posterior fibers, they will run horizontally. So all these fibers, they converge and passes through the gap deep to the zygomatic arch. So insertion point is the coronoid process of the mandible. The nerve supply is by two deep temporal branch from the anterior division of the mandibular nerve. Now what are the actions of this muscle? Remember, it helps to elevate the mandible. Apart from that, you can perform a side to side grinding movement. The posterior fibers would retract the protruded mandible. The next muscle is the masseter muscle. Remember this masseter muscle, it's a quadrilateral muscle that covers the ramus of the mandible. So it has a three layers: the superficial layer, middle layer and the deep layer. Now the superficial layer, it originates from the anterior 2/3 of the lower border of the zygomatic arch. The deep layer, it originates from the deep layer of the zygomatic arch, and the middle layer, it originates from the lower border of posterior 1/3 of the zygomatic arch. And where does it passes downward, backward at 45-degree angle, and it is inserted into the lateral surface of ramus of the mandible. Now what is the nerve supply? Remember, masseteric nerve is a branch of anterior division of the mandibular nerve. So masseter, it is a powerful muscle. It elevates the mandible to close the mouth for biting. The superficial fibers, they will cause protrusion, forward movement of the mandible. The next muscle is the lateral pterygoid muscle. So this muscle is a short conical muscle and it has two heads. This one is the upper head and this one is the lower head. So the upper head, remember, it's small and lower head it's larger. The upper head, it originates from the infratemporal surface and crest and the greater wing of sphenoid bone, whereas the lower head, it originates from the lateral surface of lateral pterygoid plate, and the origin is just medial to insertion. So remember, it is inserted into the pterygoid fovea on the anterior surface of the neck of mandible, and it also insert into the anterior margin of the articular disc and capsule of the TMJ. So the nerve supply, it is again by the branch from the anterior division of the mandibular nerve. Now what are the action? The lateral pterygoid would depress the mandible to open the mouth, and it works together with the suprahyoid muscle. So it is essential for opening the mouth. Second, it protrudes the mandible. Remember the right lateral pterygoid, it turns the chin to the left side. So remember the lateral pterygoid, it is a key muscle involved in complex movement of the temporomandibular joint. It functions like the biting, chewing, speaking are important to ensure the proper jaw movement. The next muscle is the medial pterygoid. So medial pterygoid, so it has a two head. One is the superficial head that originates from the tuberosity of the maxilla, from the maxillary tuberosity and the lateral surface of pyramidal process of the palatine bone. The deep head, it originates from the medial surface of lateral pterygoid plate and it is inserted into the posterior inferior surface and the angle of the ramus of the mandible. The nerve supply is by nerve to the medial pterygoid, that is branch of main trunk of the mandibular nerve. So the nerve, what are the action? It elevates the mandible, helps protrude the mandible. The right medial pterygoid along with the right lateral pterygoid turns the chin to the left side as part of grinding movement. Coming to next is the temporal fascia. So this part is the temporalis fascia. So the temporal fascia, it is a significant structure that play an important role in supporting and covering the region of the temporal, that is covering the temporal region. So the temporal fascia, we know it's thick sheet, it roofs the temporal fossa, providing support and covers the temporalis muscle. So remember, superiorly the fascia, it is single layered and attached to the superior temporal line that provides a stable connection to the superior part of the skull. Inferiorly, this temporalis region, it splits into two layers. So these layers are attached, inner and outer lips to the upper border of the zygomatic arch. The small gap between the two layers, it contains fat. And it contains branch from the superficial temporal artery and the zygomatic temporal nerve. Now what are the function of this temporalis fascia? So it provide structural support and coverage for the temporalis muscle. The deep surface of temporal fascia give origin to some fibers of the temporalis muscle. Next, moving to the lateral pterygoid, relation of the lateral pterygoid muscle. The lateral pterygoid muscle, it is a component of the infratemporal fossa. What are the relationship? The superficial relationship, it is related to masseter, ramus of mandible, superficial head of medial pterygoid and the maxillary artery. The deep surface, it is related with mandibular nerve, middle meningeal artery, sphenomandibular ligament, deep head of medial pterygoid muscle, pterygoid plexus, etc. Now what you can get a question in exam, what are the structures that emerges at the upper border? They are the deep temporal nerve. So this deep temporal nerve and the mesenteric nerves, they are structures emerging at the upper border. And the structure that emerge at the lower border are the, remember, the inferior alveolar artery, the lingual nerve and the middle meningeal artery. So these structures, they emerges at the lower border. And the structures that passes through the gap between the two heads are the maxillary artery and the buccal branch of the mandibular nerve. So maxillary artery and the buccal branch of the mandibular nerve that passes through the gap between the two heads. Now what are the relationship with the medial pterygoid? We know medial pterygoid muscle has a superficial and deep heads and it has relationship with the surrounding structures. The superficial and deep part, the upper part, that is the upper part, the superficial part is linked with the lingual nerve, inferior alveolar nerve, lateral pterygoid plates. And the deep part, it is related with the tensor belli palatini muscle, superior constrictor of the pharynx, styloglossus and stylopharyngeus muscle.